and welcome to the Artisan Hour. I'm Natasha and I'm here with Nurse Tashana, and she's going to talk to us all about Botox today.
Yeah.
So welcome to the Artisan Hour.
Thank you.
So to get us started, can you kind of give us a background on what Botox is?
Okay, so essentially the quick version is Botox is a complex protein. When injected into specific and targeted muscles in the face, it relaxes these muscles and smooths out any fine lines and wrinkles.
So is there different kinds of a neuromodulator, or is it just Botox, or are there different types?
Absolutely. So in clinic here at Artisan Aesthetics, we do carry Dysport and Lativo. They're essentially the same, differential reasons why we would opt for one over the other. Sometimes it's client preference. Other times, when we see clients who have been on a specific neuromodulator for some time, we like to give a break and switch to another one temporarily.
So that break, is that so they don't build a resistance to a certain brand of neuromodulator?
Precisely, yes, exactly.
Okay, so if I'm getting a neuromodulator, how long can I expect that to last?
So everyone is unique, but we do like to say dose does equal duration. So we do a full face assessment to see the strength of each muscle that we're injecting in. And typically we like to have the treatment last you anywhere between 3 to 4 months. Of course, lifestyle does sometimes play a factor in the duration. So when we see clients who perhaps lead a very active lifestyle, they may metabolize the product a bit quicker, or some sorts of medication may make the treatment not last as long. But of course, we will assess to kind of set that expectation for each client.
So when I come in and see you, say, for a Botox treatment, do we go over my medical history to see what medications I'm on if I'm a candidate for Botox?
Absolutely. So if it's your first at your first visit with us at Artisan Aesthetics, we do like to have you fill out a pretty comprehensive intake form where we review your full medical history, your cosmetic history, and then we also, just to determine if this is the appropriate treatment for you to keep you safe, as well as to achieve the goal that you have expressed to us. And we also have a conversation with our medical doctor in-house just to further determine that it is a safe treatment for you.
So this is definitely a very safe medical procedure that I'm having done, even though it's for cosmetic reasons.
Absolutely. Botox is neurotoxins that we have in clinic. They are both Health Canada approved and safe to inject by a healthcare provider.
So is there an age cutoff for Botox? I know a lot of the older generation has been getting Botox for years, but is there like an age that's too young? Do I have to be above a certain age to be getting Botox?
So the candidates for our Botox treatments is any healthy individual over the age of 18. So as long as you're not breastfeeding or pregnant or specific specific health condition, you're safe to receive the treatment.
Wonderful. So what are the differences between getting it, say, at my age, which is middle-aged, mid-40s, and younger at 20, when I wish I had started my Botox journey?
So essentially, it's not necessarily age as a determining factor. It's just essentially the strength of the muscle. Everyone is unique in that regard. So we see our younger clients who may be in their 20s or early 30s opting for this treatment for a preventative reason, to prevent those fine lines or those dynamic lines and wrinkles from becoming static. With our clients that are more mature, we are doing that to more maybe softening those lines that are there at static. And we do see there's some research that does support that with maintaining the treatment. We can soften those lines over time.
Perfect. So what's the difference between like static lines and expression lines? I've heard that was used with the Botox treatment. So what is the difference between those two?
So dynamic lines are the expression lines that we see when we make certain expressions, like either the horizontal lines we see in our forehead or the vertical lines we see when we make frown lines. Static lines are those lines that are there at rest without making those expressions. So typically our Botox treatments are targeting more so the dynamic lines.
Okay. So those I know you said are at the forehead. So Botox is really great for the upper face.
So just like our Wake Up Pretty treatment that we have here at Artisan Aesthetics, it's a lovely treatment whereby when we inject the muscles in the forehead lines, as well as what I referenced earlier, the frown lines, as well as the crow's feet, that is a beautiful treatment just to give a subtle lift and a bright lift, and just giving you that wide awake look, that rested look, I should say.
Okay, so for on the top, you can use it for like my crow's feet, my little Andrea 11s I have in there, because I have children. Those frown lines aren't going anywhere. So does that mean I would need a higher dosage of Botox in order to get them gone, or that's assessed in the treatment?
Yes. So no two client typically receives the same dosing. So we do carefully assess the strength of each muscle just to determine what the dose is. So your dose is unique to you essentially based on the strength of the muscle that we're injecting the product in. We consider the strength as well as we want you to get that full duration of action to have you back in clinic 3 to 4 months.
So you said dosage equals duration. So what happens if I find that the Botox isn't doing what I want it to do once I've had my first treatment? So like say a few days or a few weeks after.
So typically the information that we provide the client is give it the full 2 weeks to allow the product to fully set in. We do know that the action does start for some people anywhere between 3 days, even as quickly as that. But we like to encourage, give it the full 2 weeks to let things set in. And if you're feeling as though there's more movement than you prefer to have, you can definitely come back in clinic and we can assess to see to determine if we do need to increase the dosing.
Perfect. So where else can I get it besides just my upper face? Can I get Botox in, say, like my lower face or my neck?
Yes, so Botox is a beautiful treatment for the lower face as well. One of the really popular treatments here is a lip flip, and that's when we inject Botox around the muscle, in the muscle around our mouth. And what that does is, because we're relaxing that muscle there, it does give that illusion and appearance of a fuller upper lip without that added volume, that filler, that something like filler would give. So clients typically enjoy that for balancing any type of asymmetry they may have, or for clients who they notice when they smile, their upper lip does curl in and disappears. So when we inject Botox there, it does give a nice appearance to the upper lip for sure. And we also have clients who feel like they just look sad all the time. Their lips just turn downwards. So when we inject the DAO muscle there, it does lift and does give that happier appearance.
So can I use my Botox with my lip filler in order to give that appearance of like flipping that top lip and also giving me the fullness everywhere on the lips?
Absolutely, simply because Botox is, we're targeting the muscle. With fillers, we're adding volume, we're correcting asymmetry, so 2 different areas that we are targeting with those injections.
Perfect. So what about like the other areas of the lower face? Is it just for around the mouth, or can I use it in other areas of the lower face?
Oh no, so another common treatment is the masseter, when we inject the masseter muscle along the jawline here. And what that is typically for is both therapeutic and cosmetic essentially. Clients who come to us reporting things like they have a headache, they wake up with like jaw pain, or they're clenching or grinding their teeth subconsciously while they sleep. So we know that when we inject the masseter muscle, that muscle is relaxed, and client report improvement to those symptoms. And the added benefit is that it does give a nice slimming effect.
Which is amazing.
Everybody does love that.
That lower face is a big problem. So having something that would slim like that would be amazing.
Yeah.
So I've also heard of something called a Nefertiti lift. Can you tell me what a Nefertiti lift is? I know it's something to do with the neck, and that's all that I know about it.
So again, the Nefertiti lift, which is super popular right now, essentially the muscle in our neck, our platysmal band muscle, is a sheet of muscle that comes up from our collarbone all the way upwards along our jawline. And for some clients who have a really does give that nice lifting and tightening along the jawline. So it does. So it does
both. So I could use that in like conjunction with my masseter Botox and really create that chiseled,
that nice jaw,
snatched
that
jaw.
nice profile.
Oh, I love it. Absolutely amazing. But I've heard like some people have said they don't get Botox because they don't want to be frozen, that they want to still show emotion. They don't want to constantly look surprised.
Right.
Is that something that Botox does where like if I get it around my eyes, say like my eyes stay wide open and I always look like I'm shocked at everything that's happening around me?
Not unless you'd like me to, but no. Botox is meant to relax the muscle, to take away the fine lines and wrinkles. It's not meant to take away your expressions. So that does go coincide with dosing appropriately to maintain who you look like, to keep you looking like yourself, just more rested and awake.
Perfect. I love that. So like I've also heard that some people are like, oh, I've gotten Botox, so I can't lay down. I have to sleep sitting up. Is that really a thing, or is that just like right after treatment?
So we will give you some post-care instructions. We do encourage you to avoid anything like laying down or any prolonged bending for up to 4 hours only after the treatment. But after 4 hours,
I'm good to go.
You're good to go.
What about exercising, or even like the heat, because it's so hot right now?
Right.
Do I need to avoid any of that stuff when I'm getting Botox?
So some of our post-care instructions does address that concern. So day of treatment, it very minimal downtime for this treatment. Some often refer to it as the lunchtime procedure, just because you can, for the most part, jump right back into your normal routine, with the exception of exercising or anything that does bring heat to the skin, simply because we want the product to stay exactly where we inject it. We don't want it to swell and spread to neighboring muscles to avoid those unintended complications. So the day of the treatment, we ask you to avoid exercising, avoid hot tub saunas, for that reason only. 24 hours later, you can resume your normal activity.
So it's not going to alter my life in any drastic way.
No.
So I know you're injecting it into the muscles, and I get a lot of like upper lip sweat and forehead sweat. Does Botox stop that sweating?
Yes. So it does operate on the different nerves of in our body. So hyperhidrosis is a common treatment as well clinically with Botox. We can inject it for that purpose, sweating in the underarms, in the hands as well.
Oh, it's fantastic.
To definitely alleviate those symptoms.
Especially with the hot weather that we're having that option to be able to wear silk and linen out in those like bright colors without having to worry about the stains, that would be amazing.
Definitely.
So, so you were saying that I can't lay down 24 hours for exercise. Is there anything else I can expect at the appointment? Like, will I bruise? Like, is this something that I'm going to come in for lunchtime, get my injections, go back to the office, and people are going to be like, somebody punched you in the forehead?
No. So the treatment, it does, for the most part, it remains undetectable. Essentially, bruising, everyone is unique, so taking a needle to skin does expose us to that risk that you may bruise, especially if you know yourself that you're someone who bruises easily. But if that is a real concern, I do encourage you to avoid things like blood thinners as safely as you can with your doctor's caution. Things like ibuprofen and Advil to avoid those things. Avoiding alcohol intake for some days prior and day of and after procedure, that will minimize the risk of bruising.
Perfect.
You may leave the clinic with little fine like mosquito-like marks as it's described, but those typically only last for an hour.
Well, and where we live too, I'm not worried about mosquito marks because I have them all over, because mosquitoes are horrible. Because
it's the season.
It's the season for it.
Yeah.
So in that case, like if I come in and I have a consultation, that's when it's determined how many units I need, and will that set the price of my treatment? Like it's not a set price? Like
yes. So in clinic, we do offer our units at $10 per unit, although we are running a lovely promo whereby it is $8.50 per unit with our package here. But your dosing is unique to yourself, again, based on the strength of the muscle.
Okay.
Unique to you.
Perfect. Thank you so much. It was great to do the Artisan Hour with you. And as Nurse Tashana just said, we are running a promotion right now until the 18th. And it's called Bank Your Tox, where you're getting 100 units of Botox for $850.
Yes.
For $850. We're also doing an injection promotion as well. That is your 3 syringes for $1350. And our lovely Nurse Tashana and our other nurse Jess, who unfortunately couldn't join us today, are running their own special promotions of our neuromodulator Lativo for $8 a unit at both our Ajax and Port Hope locations, and you can book those directly through here on Instagram. You can text us, you can phone us, and you can also purchase our Bank Your Tox and our filler online. So thank you again.
Thanks for having me.
And we will see you guys on our next Artisan Hour.
Thank you.